The Center for Health Protection, CHP, is a public health agency established in June 2004 under the Department of Health, DH. Our mission is to achieve effective prevention and control of diseases in Hong Kong in collaboration with local and international partners. Throughout the past decade, the CHP has played a pivotal role in developing the capacity of Hong Kong's public health system to deal with various important public health challenges. There are 6 functional branches under the CHP shouldering different health protection programs. Surveillance and Epidemiology Branch is responsible for epidemiological investigation, surveillance and control of communicable diseases. It is also responsible for surveillance and prevention of non-communicable diseases of public health significance, as well as control of related risk factors, formulation of strategies and action plans, and implementation of health promotion and publicity activities. Emergency Response and Information Branch. It facilitates all emergency preparedness and management of public health crises through developing and updating of contingency plans. It coordinates exercises and drills from time to time, and it assists the formulation of risk communication strategy, including the CHP's operational directions and strategies. Infection Control Branch is responsible for developing, promulgating and evaluating best practices in infection control. It provides corresponding training for healthcare staff, supports epidemiological investigation in hospitals, and conducts surveillance on infection hazards in public health perspective. Public Health Services Branch is responsible for supporting the prevention and control of communicable diseases in the community. It provides specialist treatment and care services for tuberculosis, human immunodeficiency virus, and sexually transmitted infection. Furthermore, it supports strategy development of communicable diseases. Public Health Laboratory Services Branch. It provides laboratory diagnostic services for disease surveillance and control, health promotion and disease prevention, public health consultation service relating to microbiology and virology, and laboratory support on outbreak investigation. It also conducts quality assurance program for continuous improvement of standards of laboratories in Hong Kong, and act as reference laboratory to provide confirmatory service and technology transfer, training for laboratory personnel. Moreover, it collaborates with local and international partners on disease surveillance, infection control standards, and information exchanges. The Program Management and Professional Development Branch coordinates with and provides secretariat support for the Board of Scientific Advisors and various scientific committees of CHP. It liaises with international and regional health authorities to facilitate collaboration activities, coordinates visits and exchange programs with international, regional, and local institutions, coordinates applied researches, including research projects conducted in collaboration with universities, the Hospital Authority, and other government departments, coordinates and organizes professional development activities for healthcare professionals, and provides secretariat support to the Council for the AIDS Trust Fund. The various governments' free vaccination programs and vaccination subsidy schemes are also planned and implemented by the branch. These 6 functional branches contribute towards the multidisciplinary health protection programs under the CHP. The Emergency Response Information Branch organizes regular public health exercises to test the preparedness and responsiveness of relevant departments on public health actions and emergency outbreaks. Since its establishment, many exercises have been conducted. Recent exercises include: on June 3rd and 4th of 2010, the DH and the Airport Authority jointly coordinated an airport exercise codenamed Huashan. The exercise simulated an outbound flight returned to Hong Kong because of a passenger was potentially carrying a severe infectious disease. Government departments and relevant organizations' collaboration required reactions towards the incident. On October 25, 2010, exercise Nephrite was performed in order to test relevant departments' response to an imported case of plague. Frontline staff, geared with personal protective equipment, disinfected the possible affected area after understanding the case background. A cross-boundary public health exercise organized by the CHP of the DH and the Shenzhen Entry-Exit Inspection and Quarantine Bureau, codenamed Jasper, was conducted at Shenzhen Bay Port on May 9, 2011. The exercise scenario unfolded when a man traveling to Shenzhen was identified with fever and required to send hospital for further checking and treatment. The whole tour group was put under medical surveillance in Shenzhen. 2 Hong Kong residents from the group requested to have medical surveillance and treatment in Hong Kong. Exercise Jasper improved the communications and coordination between the Hong Kong government and Shenzhen Entry-Exit Inspection. On January 9, 2012, exercise Jadeite was held to test the preparedness of government departments and relevant organizations to respond effectively in screening and evacuating involved residents in a major infectious disease incident. The exercise provided an opportunity for the DH and relevant organizations to try out relevant contingency plans and identify areas for improvement. It also enhanced community and healthcare personnel awareness, preparedness, and the ability to detect and respond to possible epidemics. Exercise Amber was held on January 17th and 25th of 2013. The exercise simulated that 3 residents of an elderly home were close contacts of a novel influenza. On-site quarantine was set up in the elderly home where the 3 residents stayed. The exercise aimed at testing the response actions to the locally acquired novel influenza infection of a Hong Kong citizen, with emphasis on the raising of the response level according to the risk to the community. The CHP arranged a high-level interdepartmental desktop exercise codenamed Exercise Ruby on March 27th of 2013 for testing preparedness for the possible outbreaks of severe respiratory disease associated with the novel coronavirus. The exercise had served to formulate and oversee the implementation of a coordinated and timely response and disease control strategy, and decide on measures to be taken which will have a wider impact on the community. Exercise Coral took place on November 21, 2013 and March 3, 2014. The exercise simulated the situation where Hong Kong encountered confirmed local cases during the peak season of dengue fever. The scenario centered on the identification of a Lantau resident as being the first confirmed local dengue fever case since 2010. Response measures, including vector investigation and control as well as surveillance of suspected cases, were carried out immediately. On June 23, 2014, the CHP also held an exercise codenamed Opal. The exercise simulated influenza pandemic in Hong Kong, where large numbers of patients were admitted in all 7 hospital clusters under the hospital authority, and huge demand of anti-influenza drugs were required. Various services, units under the DH activated their contingency plans, opened temporary clinics, distributed the drugs, and replenished stocks by emergency procurement with the assistance of the Government Logistics Department. Exercise Topaz involves a series of multi-agency drills based on the Ebola virus disease, EVD, Preparedness and Response Plan launched on August 20, 2014. The exercise was divided into 5 parts, including village house disinfection, testing coordination and procedures between the CHP and the Food and Environmental Hygiene Department, FEHD, regarding residential disinfection, guest house disinfection, testing the coordination between the CHP and the FEHD on field investigation and disinfection in a guest house setting. Large-scale interdepartmental and multi-agencies tabletop exercise, quarantine center, enhancing infection control measures, and airport ground movement, optimizing the contingency plan in response to EVD cases. The CHP plays an important role in controlling and preventing diseases and performs various drills to strengthen the responsiveness in case of health crisis. The CHP is developing into a better disease control agency after years of planning, experimenting, and drilling. The CHP will continue to work hard and cooperate with local organizations and international health organizations to improve the control of communicable diseases, raise community and health sector awareness, and strengthen public health crisis preparedness and response to provide a healthier environment for the public.